concluded a 5-day compliance enforcement operation targeting illegal drug outlets in Eastern region in 11 districts of Mbale City, Mbale, Busia, Butaleja, Budaka, Palisa, Kapchorwa, Kweni, Bukwo, Sironko, and Bududa. During this operation, a total of 149 drug outlets that were operating without licenses or with unqualified personnel were closed, and 311 boxes of assorted medicines worth over 80 million Uganda shillings were impounded. This operation is in line with the NDA's mandate to protect and promote public health through effective regulation of human and animal medicines and healthcare products. NDA informs the operators of outlets whose drugs have been impounded to visit our Eastern Regional Office in Tororo to be guided on how to comply in order to receive their drugs back. All operators who are still operating without licenses or unqualified personnel are hereby directed to hold all operations until the licensing requirements are fulfilled. We appeal to the public to always buy drugs from owner-licensed pharmacies and drug shops, remain vigilant, and report anyone suspected to be involved in drug crimes on our toll-free line 08 00101 999, or our WhatsApp number 0740 002 070. Your safety is our priority. Save drugs, save lives. Thank you.
Okay.
National Drug Authority ekoze ebikwekweto emaze ennaku 5 ng'ekola ebikwekweto mu region eno nga egenze mu districts zinamanga, Mbale City, Mbale District, Busia, Butaleja, Budaka, Palisa, Kapchorwa, Kweni, Bukwo, Sironko, and Bududa. Tugaddewo amaduuka g'eddagala 149 agabadde gatalina layisensi oba abagakolamu nga tebalina bisaanyizo, ne tubowa box z'eddagala 311 nga zibalirirwamu esente za Uganda miliyoni 8. Eddagala lino ligenda kutwalibwa ku ofiisi zaffe e Tororo. Bannannyini ddyo bajja kuzigoberera mpaka Tororo babalungamye kiki kye balina okukola.
Person of NDA who is doing duties, and we call them district drug inspectors. They are doing duties of NDA in those district local governments. Sometimes those people are so close to the population, and usually sometimes they even do some negative network, which sometimes, according to the population, they may think that it is NDA doing it. But when you go deeper, you'll find that even they can call their people, maybe they know, and warn them or about NDAs coming in those places. And there is a way some people, especially the press, they take it that these people, the traditional staff of NDA. But districts have people who have some relationship.
They have been endorsed to NDA.
Yeah, to do our duty, to support them. And even during the enforcement, we work with them. We call them district drug inspectors. They get an appointment letter from NDA after being nominated by the district local government. So David, I'm the regional manager. I'm the regional inspector of drugs, Eastern region. Our offices are in Tororo, and our region covers 16 districts. Our jurisdiction goes it has 3 sub-regions. We have Bukedi, of course, including Bukedi North and Bukedi South. We have those are 7 districts that side in Bukedi. We have 7 districts in Bugisu sub-region, and then 3 districts in Sebei sub-region. Yeah, one question was talking about this enforcement we've had, it covered, we have 16 districts, but we were able to cover only, because it was only 5 days, we were able to cover only 10 districts and 1 city, because Mbale has a city and a district. The first question I would like to talk about is about this region having border districts, including Busia, places like Malaba and the Ruakaka. Those are some of the border or the ports of entry. We also have border districts like up there when you go to Buko. There is a swamp. The swamp project, we are also trying to put there a port of entry. Eastern region is characterized by smuggled drugs from Kenya. And the major product we've been struggling to take away is Lonart. That is, some people call it as Coatem, but there is that brand Lonart. There is a registered one, and there is also that one which almost looks similar, but it is smuggled. It is sold in Kenya, and they bring it here very, at a cheaper price. They buy it at black market. You'll find it in many drug shops, even pharmacies, in Busia and other districts, up to Buko, Kwen. And whenever we find it, we recover it and give them a search certificate for them to be able to go back to the supplier and claim it. And some people here, where we find it, they say they buy it from pharmacies in Uganda. And it gives us an impression that some people use the water, it goes through those ends and get it from that side, and it is sold in Uganda. But the rate is going down. Also, even veterinary drugs for animals are smuggled, and you can get many around here. And also, this is a product which is not registered here, Kifaru. This is the common name is Viagra. There are those registered brands or trade names which are registered here, but Kifaru, 100 milligrams, this one, you find it in so many drug shops. It is cheap, and it works like the Viagra, but it's not registered here. So we always impound it and some other products. But what we are doing, we have a PMS unit. We have a manager, post-market surveillance. We normally get time and do that activity of auditing these drug shops and pharmacies. And specifically, we look for products on the shelves, which are already on the shelves, and we try to recover them. But the rate is going down because people have realized that the operators, drug outlet operators, that they are losing their money, because whenever we get them, we don't pay them, we recover them and just leave a search certificate with them. Again, something related to that is about hawking. Somebody talked about selling drugs, drugs on buses, what interventions. Actually, we have a program for fighting hawkers. And whenever you take a bus, you realize that you find some doctors, the so-called doctors, who come board, then he gets off after like 20 kilometers, another one enters. They have their stages. They have drugs in bags, but NDA had a program which was under the PR unit, and we were trying to sensitize. They were working with the regional inspectors of drugs, and then the management of bus companies at the bus parks. And we even started putting posters in the buses. The only challenge is that it has not been so sustainable, because we can't be in those buses all the time. Yeah, after doing it and they stop for 1 month, you find that later they will come back. So we may need a more serious intervention, but all these things are done because people are getting money out of it. Just like hawkers in markets, those people who sell drugs in markets, especially animal drugs, they also relate with for animal drugs, these veterinary professionals in the districts. because whenever there is a market day, these shifty markets, animals are collected, and some of them, and farmers come around, so they usually access these drugs from there. But we always advise them to go to the gazetted places, the drug shops of veterinary drugs, which are licensed. And the challenge here in markets is that these people who come, usually the market managements of these markets, they collect some money from them to allow them to sell. So we have a wide range of people we have to talk to, and but we are trying to succeed in many of these things because NDA partners and collaborates with law enforcement agencies. Even in this activity, we are working with the regional police headquarters, the RPCs, the DPCs, and they were giving us enough officers and men to provide security. And even as a region, during our routine support, supervision, enforcement, we do all these things and surveillance and work on most of the things. So that was about the illegality of drugs and what. Now there was a question on qualifications to operate a drug shop or pharmacy. For drug shops, many categories of nurses are allowed to operate apart from nursing assistants. Now, to operate, we need the owner. The owner can be just a business person. You open it, or you come as a business person. And we want the owner to have a team. This has been a challenge for this year because now all government agencies, to license anyone, you must make sure that that person has a team. It has been implemented, and many people, this is one reason why many people, because there was somebody who was wondering why are these people failing to comply. Some people have been finding it difficult to comply because they did not have team. But they were even buying it. I mean, you pay to these agents and they give you the team. But you can even get it online. There's a way you use your phone and get a team. And the team should be for the owner and the specific name of that clinic. I mean, drug shop. But for pharmacies, now, if you are the owner and you're a business person, you must get a qualified person to register as the in charge of that drug shop. Even for vet, the operator should be somebody who has vet qualifications. There are some relevant vet qualifications. We can't get into details of that, but we have all that documented. For pharmacies, it must be a pharmacist. And when the pharmacist resigns, you have to get another one. And for a pharmacist, he must be incorporated as a director. Of course, without shares, but a kind of an administrator who will be there to regularly supervise this pharmacy. And we normally, when we visit the pharmacies for licensing and support supervision, we want to see the attendance of the pharmacist in this pharmacy to ensure that the pharmacist is not doing his work online, but he physically attends this. As far as another one was talking about punishments, serious punishments usually come along the arrests. If we find a drug shop or a pharmacy and we have to arrest someone, there is a procedure we go through. We take the pass. We have law enforcement officers on our team, and we work with the police. We go to police. These people can get out on police bond, but the case will continue until we get a logical conclusion. And they make statements. And what happens is that the law is now very old, whereby the punishments in terms of financial terms, they are still very small. But it's about, usually it's about, you can be arrested for like 1 year, 2 years, or 3 years, depending on the gravity of the case, or a fine, which is not more than 1 million. However, related to this, that will come later. Connivance has been talked about for government drugs. Okay, the cases which we normally get, and when we enter drug shop, which we call illegal, usually it doesn't have a license. And why doesn't it have a license? Either the premises are not suitable, because we look at the suitability of premises. If the premises don't have a ceiling, the walls are not, can't be easily cleaned, or the floor, we shall now not give you that certificate for suitability of premises. Then those qualifications we've talked about, the people who are qualified to do that work. And then there are some other things like TIN, which will also stop you from getting this license. And usually the cases we charge them, or what we record, is unlawful possession of classified medicines without a license. And 2, operating the business of a pharmacist without a license. And 3, rampant clinical work. Somebody also talked of drug shops and clinics. People are mixing up that, but clinical practice is handled by Allied Health Professionals Council. For us, our mandate of ensuring availability of quality medicines to all the people of Uganda and protecting and promoting public health through effective regulation is about the regulation on drugs. So when you stop and you are selling to the public, we are interested in that. If we find you with a display and you are selling to the public, we usually don't tamper with the clinic, and we may not ask you whether you have a license for the clinic or not, or it's in process. We always look at the drug shop and we remove these drugs. For government drugs, there is a special unit in State House which is handling that, but whenever we get them, we hand them over back to head office, and sometimes they liaise with the National Drugs Authority, which has to follow up and to know what is happening. But those drugs mostly, they come from the health centers. There's some connivance in health centers where these drugs come from. Regarding relationship with URA, for example, this side, because we have URA offices in Malaba and Busia, we have a regional manager in Malaba. We've already interacted with that one, and we have an enforcement office in Busia. We've been visiting them, and whenever they get some information, they give us this information, and we take it to head office, and the team will come from head office to go and interact. But we've reliably learned that some drugs come through the night buses. We don't have our inspectors at night. We depend on URA to give us that information, kind of intelligence information, and we use it to track down these people. Yeah, I think those are some of the questions I want to give to other people time.
Dear press, NDA and enforcement. Today, I have joined NDA to make a brief presentation as per drug safety is concerned. The purpose is to continue to explain or educate to our dear public on the safety of animal drugs and chemicals. Dear our people of Mbale district, you are consumers or the end users of products, goods and services from farms, namely meat, milk, chicken, eggs, hides, skins, manure, animal power and companionship. This means that you are directly with the animals and their products. You are therefore direct or indirectly exposed to drugs and chemicals and need to take precautions to achieve safety and effectiveness. Majority of you are farmers, and therefore your incomes depend on livestock for your households. The farming enterprise is your business, is therefore at stake if the drugs are misused. Again, majority of animal diseases are on the increase and are transmitted directly or indirectly from animals to people. Now, our appeal is this. One, we request you to effectively adopt the prevention infection control approach, which is cheaper and safer on our animals at all times, and this minimizes the excessive use of over-dependence of drugs. Two, always get advice from veterinary staff who are deployed in all sub-counties and are employed by government. It is wrong to go and take drugs across the counter without a prescription. Always report cases of animal disease outbreaks for immediate action and management. We request our local leaders always to be on the watch out for illegal movement of animals and animal products. Thank you. This is Dr. Philip Wachimwere, DV Mbale. Thank you.
My name, I'm here for the DHO Mbale. Want to appreciate NDA and join NDA in this struggle to make sure that people get safe medicine. As a district health office, the mandate that we have is to ensure that our people are healthy. And you know very well that medicines are meant to heal, cure ailments, but medicines can also be a danger to the people if they are not handled well. So because of this, we join NDA strongly to ensure that our people can access safe medicines that can be aimed at making them healthy. Now, this will be done because we know most of our people, when they are sick, the first place they go to is a private facility, a drug shop, a clinic, and before some people go to government facilities, they have gone to a private facility, and most of these are drug shops. So we want to appeal to the people who are running drug shops to ensure that they comply with the available laws that govern the management of these drug shops. Ensure that you have a qualified person, and ensure that all regulations to do with how drugs are kept are adhered to ensure that our people get medicine that will help them, or else the arm of the law will catch them. Like the manager said, the district health office is supported by the district drug inspector to support NDA work in the district, and we expect that they are doing due diligence to ensure that there is drug safety. Misuse of drugs and drugs that are not kept well, the way people move to drug shops to pick drugs across self-medication has led to an increase in antimicrobial resistance, which is a big issue that we are struggling with as a country. So I want to appeal to our people, the professionals who are opening up these premises. If you want to open a drug shop, please go specific for drug shop. If you want clinic, you need to go to the to allied health professional. And at the district, sit someone who is responsible for regulating allied health professional. So they are supposed to look at the clinics before they can license you. If you want a drug shop, we have the district drug inspector. Thank you very much. Mr. District Health Officer.
The member of the public press. My name is SSP of Fellow Defense. I'm a deputy RPC in Elgon. With me, I have the PRO Elgon and the OC station by the CPS. You're most welcome. I would say really applause to the NDA members for having come to Elgon. It was timely because we had just begun the year and we need to keep our Ugandan safe. I wanted to answer just for a few things that were asked here. For instance, somebody asked that what records do we have in the police? For instance, that was last year. I would really say if I had given us that chance, we would have found the CID officer to give us that statistics. But as for now, we may not have the real statistics or statistics of people who apprehended last year. And still, we don't do these things and we go with the name of the word of the NDA. We don't just go on our own and